when it comes to a little cosmetic improvement, a cosmetic filler with the nickname vampire filler may make you look a titch younger, but not too Hollywood. I wonder down the road, as the scientists do, if it does it have to be human to human? One day, can you have pig plasma? Right?
Well, again, we're trying to go natural. We're trying to go natural.
Yeah, I totally get it. It makes sense to use your own.
Right. It really
sure.
does, and it's fresh, and that's the issue. These are healthy parts of the tissue. It's basically it's almost a transplant.
Okay, so once it's injected, and where do you inject? You inject with a needle? Ow.
It's a needle. It's a small.
Little
We put a little numbing cream on the face just to numb up the area. We can inject it under the laugh lines, under the eyes and the hollows, along the jaw lines to tighten up the skin, into the cheeks to fill that out. Wrinkles on the face.
Really?
Yeah.
The tiny wrinkles, big wrinkles?
Both.
Tiny.
Both.
So just a little bit.
Just a little bit. Little crow's feet works beautifully on. Also, again, from my reconstructive past, it's a great treatment for acne scars, for those pitted acne scars.
Yes.
It really works out nicely, and I think it's much better than what we have available. I use it also in surgery because I want my patients to heal a little faster. I use it during rhinoplasties, and I think it limits swelling. I think it limits bruising. We can transfer fat. Now that's also kind of the rage, to take body fat from one part and put it in the face. Mixing this with the body fat, because it enhances not only collagen production but new blood vessel growth.
Sure. Well, I had a friend who had a full facelift, and I won't say who, but we're telling now, you know. But she said it hurts.
Yeah.
Like it's major surgery. So remember that.
Absolutely. Cosmetic surgery, again, we tend to downplay it, but it is major surgery. It's something that you don't take lightly.
Right.
This I don't think is ever going to replace full surgery. I think there are still going to be cases, like any of these minimally invasive procedures, they don't do what surgery does. But again, the trend is less. The trend is less downtime. I haven't had a single patient tell me they've missed a day of work after this treatment. There's a little bit of swelling, a little bit of bruising for 1 to 3 days. But really, it's easy to cover.
So we're looking at the before-after there.
And that's a pretty typical response. That woman had just laugh lines injected. And again, she went back to work the next day.
And she looked pretty much the same the next day, and how long did it take for this product to kick in?
Exactly. What happens is, again, we're injecting a lot of this water, the water part of the blood, the plasma. So that gets absorbed. They look a little bit swollen for about 3 hours. That gets absorbed, and it looks pretty reasonable. It may not be everything that we get. Typically, as the body starts to produce new collagen, we see an effect in about 1 to 2 weeks. And we have biopsy studies showing that we are producing new collagen. We're basically rejuvenating the skin. We're renewing the skin from the inside out.
How long does it last once you've had the procedure?
I've been using it about 2.5 years. I've had a few patients come back after about a year and a half saying, I think I'd like a little bit more. It's probably a combination of that. Some of that effect has been lost, and also because they're a year and a half older.
Right.
But again, when we look at the tissues, we can't stop that.
No.
When we look at the tissues, it really looks like normal skin. This is not skin and then something else new. It looks like just normal, healthy skin. So I'm anticipating this is going to be pretty consistently a long-lasting effect.
Okay, so how is this different from a Botox or a Restylane?
Right. Restylane is a foreign substance that fills up the tissue under a wrinkle, and it works very well.
But the substance from what?
Well, Restylane is brewed from bacteria.
Oh, okay.
It's very safe, but it is brewed from bacteria, and it's a foreign body always in your body until it gets absorbed. Restylane going to last 6 to maybe 7 months. Botox paralyzes muscles, so you're not wrinkling, you're not folding that skin above the muscle. This doesn't do that. This just basically bulks up the skin and probably also bulks up the tissue below.
Sort of works inside out, because Botox, I had a friend who had a big wrinkle there. She had it done and she couldn't move her head.
Right.
Or she felt, ew.
Exactly. And that goes with that Hollywood syndrome that people don't want to look like they've been done. They want it to look natural. A lot of patients even will come in saying, leave me with a little bit of the wrinkle. I'd rather be able to move my eyebrows and squint and have little wrinkles than not have anything at all.
No, and I think aging gracefully is a beautiful thing, and nobody wants to walk out and look like a starched jaguar.
Right.
You know?
Exactly.
Or,
I think that's a great thing.
Or a Michael Jackson, something gone way too far.
Right, right. Or the Priscilla Presley. There are problems, and that was a filler. You know, that's a foreign body, and you can have problems. Most of the fillers we have are very safe, but I think there's a large group of patients, we know that there's a large group of patients who are thinking about some kind of filler, some sort of skin rejuvenation, who haven't done it and don't want to do it. And I think a lot of it is that they're turned off by the idea of something foreign in their body.
You bet. And now what about this lip thing? Oh, you can land a 747 on some of these Hollywood lips. I'm not kidding. These big fat lips, not so trendy anymore. Can you reverse it if you've plumped up the
Well, it
lips?
depends on what you've done to do that. If you use silicone, silicone's a permanent material. It stays in there forever. The only way to get it out is to cut it out. Restylane, Juvederm, Radiesse, all these other fillers are more or less temporary. One nice thing about Juvederm and Restylane, they're hyaluronic acid derivatives. It's like a gel. It's a sugar gel, essentially. There is an enzyme you can actually dissolve that material. So what I typically do for a first-time filler, if they're a filler patient, if they are interested in a hyaluronic acid or a filler and they're not interested in Selphyl, I always go easy. We start out with something that's reversible because they may not like it.
And it's difficult to undo a bad result.
Exactly.
I know. And so the questions you always ask when you see a surgeon or anybody who's going to work on you.
How often do you do this? Is this a part of your practice that's an important part? Who does it? Are you board certified? Board certified plastic surgeon, facial plastic surgeon, ocular plastic surgeon, dermatologist. You should be a key core member of one of those core groups. Do you do it or does your nurse do it? Is an issue. You know, if your nurse is doing it, I'm not sure why you're going to that doctor's office, because that nurse could be in any doctor's office. Is this what you do in general? If you're going to a foot specialist who also puts Botox in wrinkles, what does that person really know about the face? If you're going even to a general plastic surgeon who does really just breast surgery and tummy tucks, and they don't do a lot of work on the face, it may not be the ideal situation to go to.
Well, the artist part of you is so important, the creative artist part, because you have a sense of proportion. And I don't know what many of your patients ask for, but I'm assuming they want to look like they've been on a holiday to the south of France, and they look better. I mean, we're not, again, we're
there has to
all
be a
grown up now. We don't need to fib about it.
Exactly, which is nice. No one should feel embarrassed about it. But there has to be a meeting of the minds between the patient and the doctor, and that's always the most important part of the session is the consultation. They need to know that what I think looks good, and they need to agree that what I think looks good is what they think looks good. And
no matter how much of it you have, you won't find love. It's not about that, you know, your personality won't change.
And that's something we always look for.
The psychological profile.
Terrific, absolutely.
Very much so.
Absolutely. One of the things about Selphyl that I think I do like is that patients do exactly what you just said before, that they come in saying, you know what, I know I look better. No one can really put their finger on it. It's a very subtle difference. It doesn't look overdone, and in certain respects, it kind of comes on gradually. So they get this improvement over a 2 to 3 week period. It doesn't look like they were done. Okay, now do you have people who have had issues with it? Problems, side effects, being allergic to their own plasma? Not that I want it to happen, but it would almost make it easier for me. I have not seen any side effects in 2.5 years. The one issue is that there is a rare patient who just doesn't generate, their tissues don't generate an adequate response. And we can usually see that after one treatment. If after 2 to 4 weeks that there's really not much of a response, they may not be a good candidate for that. But that's less than 10%. That's probably on the order of 5%. Could they be somebody whose immune system is compromised, somebody dealing with chronic disease, diabetes, something like that, or is it related? It's again, if you think back to what we're doing, we're basically harnessing the wound healing mechanism. If you have someone who's so ill that they just can't heal a cut, they're probably not an ideal aspect. Right. But diabetics heal, people with heart disease heal, and I haven't found anybody who's really not a candidate for it. Interesting. And it doesn't matter the blood type? Would a B type or an O type do it faster? The body takes those are the red
more
cells.
Quickly?
We're looking at platelets, so we're bypassing that.
So it doesn't matter. Male, female? It doesn't matter.
Young, old? Young, old doesn't matter. Smokers, I tell your viewers, don't smoke. It's nothing good for the skin. It probably would not help the process. Right. Because it's just a bad thing. Sure, the anti-smoking campaign, one of the most powerful, aside from the fact that your lungs are being terribly compromised, that you're going to look like a wrinkled monkey. Exactly. Vanity's good. If it helps people stop smoking, you bet. Great. You bet. And this is a top beauty innovation, seems to me. I think so. I think it really is a game changer, because now we're really getting back to what's important. We're getting back to the patient. Right. Available in Canada yet, do you know? Absolutely available in Canada. Oh. Throughout Canada. Well, I'll just be buzzing right over. You don't need anything.
Thank you. Nice to see you.
Nice to see you. Thank you for your time.
Nice to meet you. Dr. Anthony Sclafani from New York. 2 practices in New York, right? You in 3?
Two in Manhattan and 1 in
You're
Westchester.
busy. No wonder. Coming up. So far, it's been a wild and crazy ride from Mormon missionary to comedian. Actress Jessica Holmes gives us a front row seat to her screwball life so far and a new memoir, I Love Your Laugh. Next.